Great. So are there any questions for our panel? Yes.
Hi, thank you all so very much for your perspectives. Jason, I had a question for you. I'm really so glad that you brought up this issue of trust, because it's something, so I'm sorry, my name is Elizabeth Stahlberg. I work with an alliance of scientific societies, agronomy, crop, and soil scientists. And, you know, our scientists just bang their heads against the wall sometimes about this issue of trust. And you know, we've had those types of issues in the health sector too, where, you know, lots of portions of the population have not been treated so fairly by the medical establishment in the past, and so there are issues of trust. And in the food sector, you know, there's dietary issues of trust where you have conflicting information. You know, this year it's one thing, the next year it's something different. First, you know, fat, then cholesterol, then sugar. What, you know, and still I see things like we should be eating low-fat dairy. Well, why? You know, so and the research isn't always there all the time. So you have these issues of people. Why should I trust you now? So I was wondering, with all of these behavioral nudges that you have looked into, what kinds of nudges actually get people to trust more in actual, you know, the scientific data that's there?
Yeah, maybe David can talk about some of the behavioral stuff too. There's a saying I've heard a couple of times which is, if you don't trust me, the science doesn't matter. If you trust me, the science doesn't matter. So, you know, the point is the way people, you know, take information these days, they first look at their relationships and whether I'm sharing your values or not. And so I think this is integral to this whole, you know, whole discussion. And I don't think we know the answers to that. The science of communication is a field that I think we need to know more about, and I think it's a field that's growing. It's sometimes a frustrating field because it reveals a lot of biases in the way we take on information. But I think, you know, one of the things that Kip Tom did at lunch, one of the things I tried to do with that Unnaturally Delicious book is I think, you know, people, it's hard for people to get excited about a lot of farm and food technologies because they don't see the benefit, and it's hard to understand. And so, and it sounds cliche, but telling those stories of here's why I'm using these technologies on these farms really matters a lot, and in a way that comes from not an academic, but somebody who's actually benefiting from those technologies, I think really matters. But in a lot of cases, I think the solutions are in the technologies themselves. When the technologies start delivering benefits to consumers, they will accept them because they see what's in it for them. I think the last thing I'd say there too is we should probably be more humble. So I actually skipped over a slide of one of the challenges we have in working on these issues is there is a lot of uncertainty in the actual like biological and nutritional sciences. And you're exactly right, you know, eggs were supposed to be bad, now they're not an ingredient of concern. And so I think just a little more humility would go a long way towards helping us out a little bit. And, you know, and I think one of the ways we can do that is pointing to multiple outcomes. So the cage-free thing, you know, there's not a perfect answer, but let me tell you what we think are our best ideas of all the various consequences. We're not going to tell you what to do, but we think it's going to have this impact on cost. We think it's going to have this impact on the environment. We think it's going to have this impact on the animal. Now it's up to you. And I think that might be a little more of a productive kind of conversation. But I don't know, David, I know you've worked in this issue of science communication.
Yeah, sure, and I think you touched on most of the things that I think are really, I mean, really I do think the key, particularly if you're talking about GMOs, is being able to articulate the benefit to the consumer. I mean, that's really going to change things, at least from the studies I've seen, the studies I've been able to conduct. There's an issue about these sort of niche products, and I think it has a complicated impact. I had a master's student who just completed a study looking at people who follow gluten-free diets when they aren't sensitive to gluten at all. Right, because they believe in the health benefits, and the interesting thing is he could introduce placebos and they would be just excited about some new fad diet that didn't really exist, right? Which tells you something, that there are people out there who are driving the types of information that are being advertised, the types of things that are being claimed about our food that are basically following fads. And that impacts that trust. I mean, it's eroding a public good of trust. And we don't understand that, nor do we know how to grapple with it, because it's very hard to get people to stop claiming things that are true in our system, right? So I think that really complicates it, and it creates an issue that we really need to tackle.
I would just add that I do think it's a social movement, you could categorize it that way, anti-GM, and that there are these leaders that are a lot on social media. But it's interesting that some of the people who were anti-GM, like Bill Nye, the science guy, for example, came out now, oh, I've looked at the science, I'm now for GM, and I apologize. And there's been some other key anti-GM leaders that have switched sides. And I think it's sort of interesting that the comparison is being made to climate change deniers. That okay, if you are anti-GM, you're really anti-science. And I think a lot of people don't like to think of themselves as being anti-science. So the pendulum might be swinging.
Hi, I'm Ruth Saunders with the International Dairy Foods Association. Just a quick question for you with relation to food insecurity. Did you see or do you know of work that has looked at the incidence of food insecurity as it relates also to the increase of obesity? And one other quick question related to that, SNAP and the ability of SNAP to address food insecurity. Do you know of innovations, technologies that would relate to giving those incentives that might move towards using those benefits in a more effective way?
So a couple things. First of all, unfortunately, some people think food insecurity and obesity are tied. They really aren't. It's just the fact that poor people are more likely to be food insecure, poor people are more likely to be obese. However, if you know that somebody's food insecure, controlling for other factors, they're no more likely to be obese than anybody else. It's a common misconception. And I think it's it's sometimes a dangerous misconception because people think that if you do something to improve food insecurity, you may hurt obesity or something. We should talk about those two things directly opposite. This whole thing, so one other frustrating thing about SNAP and obesity, everybody, for economists, of course, we think SNAP participants would be less likely to be obese. You're giving SNAP participants more money in order to purchase better food, right? And so, therefore, is that, nobody says that Bill Gates is the biggest person in America because he has so much money. But in reality is that people talk about SNAP participants. It's like, oh, you give them more money, they'll be more likely to be obese. Of course, we all knew that this was false, but a lot of people said that, including, I won't mention any names, but some really bad work was done. Unfortunately, though, great work was done by ag economists to show that A, either SNAP has no impact on obesity, or B, it actually leads to reductions in obesity. Okay, so whenever people say, how should we improve SNAP to make it better to address obesity? I'm fine. If you want to make SNAP better, I got some great ideas, including we have a paper coming out with Russell Sage Foundation, which shows that basically what the impact of increasing SNAP benefit levels would be on alleviating obesity. We could talk about incentives and all these things. But I don't think we need that for SNAP. SNAP is a great program, and some of these incentives may discourage people, and don't get me started on restrictions, that's even worse. But at any rate, in other words, in our discussion about SNAP we should be talking about how do we make sure people get on SNAP, how do we make sure they get as much benefits as possible, and that's what will improve the well-being of people. These incentives, fine. And David's work and Jason's work and Joe's work is all great on that. And I think it's important insights from that. But first and foremost, let's make people stay on the program. Let's people make more benefits.
Really quickly, Carrie Calvert, Feeding America, and I'm not the ringer in the audience to address a question to Craig because we work with him a lot. But to David's point of unintended consequences of policy changes, I remember lobbying on the Healthy, Hunger-Free Kids Act. And the real discussion between do you spend money on increasing the benefit reimbursement rate for school lunch and improving the nutritional quality, or do you address the very real fact that there's millions of children that don't have access to food, especially during out-of-school times? Yeah. So the quantity versus quality issue, and the issue of the waste increase now that fruits have to be given is a perfect example. A little known consequence of that is that USDA makes less planned purchases of specialty crop purchases through Section 32 that go directly to food banks because the purchase requirement is being met by that increased use of fruits and vegetables that are then being thrown out at public schools. And obviously that's not a policy argument. You don't want to pit low-income children against clients at food banks. That's not really the solution. but how can we use data to better make this quality versus quantity discussion when policymakers aren't always driven by science and data?
Could I make a first, before we get expert talking about it, could I talk a little bit about national schools? This is a classic example of a not well thought out policy for its implications for poor children in the United States. When they implemented this healthy thing, one of the things was they capped calories. For a lot of kids, that school lunch is their most important meal of the day. And when you start telling them you can only consume so many of calories, like when my kids get home, they're like, I'm going to dig into some good food in that pantry. Not good food, not healthy food, but food. If you're poor and you go home to empty cupboards and you can't get that food, that's bad. I'm not saying that the healthy meals thing was a bad idea. I am saying, though, is that not enough people were talking about the negative implications this had for low-income children in our country.
Yeah, I just echo that. I mean, I think, to me, the problem, if I'm going to caricature the sort of process by which this came about, is they went and talked to a bunch of nutrition scientists, people who had done the health work to figure out what optimally should be eaten and put that on the tray, and didn't think through much of the rest of the system or how to motivate kids to eat it. And really, I think that's the piece that needs to be there. And as you know, it sounds like they're talking about revising the nutrition standards again. No matter what direction you're going with it, trying to free things up or make it less expensive, whatever you're doing, I think you need to have the behavioral scientists involved to avoid exactly those sorts of problems.
You asked about the data. I mean, I think, you know, David did a lot of this work, but just, I don't think we knew what, like, the amount of food waste was. And so that was one, like, just knowing that it was happening was important. Actually doing the experiments to show that it was an issue and how big it was is an important part of the debate. And that didn't exist till folks did it. And then I think some of this behavioral economic stuff, you know, put the fruits first or whatever. You know, if you're going to do the policy, there's probably some small, very low-cost things that are not obvious all the time, but sometimes just tinker around with stuff and it matters. And I think, I think Elle's work has been very influential in that regard. So I think, you know, this sort of experimental data is very useful and can be impactful. But I will echo the other thing too. Is I think what economists bring to the table on the child lunch, or whether it's the dietary guidelines, is, you know, there's almost no consideration of the behavioral response of consumers to the policies that are being implemented. And I think that's one of my biggest beefs with a lot of that stuff. You can pay me the $20 later.
Well, unfortunately, that's all we have time for today, but we really appreciate your participation and, of course, all the participation of all the speakers and moderators and our keynote. Thank you again for coming, and don't forget to read the rest of the report. Thank you.